And one of the experiences you have when you're under is it's a very somatic experience. And that's because it's affecting your brain. You'll feel it in your body. And that one is what ends up really lasting for people, like shifting up their whole brain space. The brain opens up unlike it's been open since you were 5 years old. Because after that, you started patterning in your thinking.
Yeah,
And
it's what
that's,
Aldous Huxley called the doors of perception, where the band The Doors got its name, right? So your doors are opening. There's all these frequencies, right? So it's kind of
yeah.
like a radio dial.
Mm-hmm.
And then you turn it, and then certain stations come in, and then you like certain stations over others. And then as you grow up, you're just listening to 2 or 3 stations, and there's a
That's
whole
right.
bandwidth there that you
That's
could
right.
tune into. And when you take these drugs, all of a sudden you're realizing that there's stations of amazing music almost at
Yeah.
every turn of the dial. And then
Right.
if you're really having a good time, then you get all of them at once. And
Mm-hmm.
that could be a really
It can
eye-opening
be
experience
overwhelming.
too.
But
Yeah.
this is what is different about using these drugs for healing versus using these drugs for recreation. If I'm going to use them for healing, I'm going to actually spend an hour or two talking to a therapist about, I want to understand the mechanisms of action. I want to understand dosage. I want to understand a whole lot of things about me. But then I want to be able to talk about what's my hope and intention in this
Right.
particular healing thing, right? That's preparation. We do the healing. We're asked a couple very open-ended questions of things we might want to remember when we talk about this tomorrow and next week or whatever, which we're going to let the person rest. Then when we do start talking about it, we're curious about if there was anything that they would like to see develop further in their life or think
Right.
about more in their life, right?
Yeah.
This is integration.
Intentionality. You're bringing intentionality into the
We're bringing
experience.
integration. We're wanting to help
Yeah.
them manifest what they're wanting to see manifested in their life from any wisdom that came out of this. And sometimes it's there right away. Sometimes it's not there for a week or longer even. So we're just inviting them to keep being curious if there's something that's wanting to, because the brain remains open, especially if you're on MDMA or something with a longer window, psilocybin, 5 hours or whatever. The brain is going to remain open for another week or two or more, depending. And we want to work with that because we want to help them or support them in shaping their brain and their forward movement in a way that they really want.
Yeah. And it's been effective. And it's a shame, to your point, that the drug war, we can
Yeah,
blame Nixon for this too, along with a
right,
host of other
exactly.
things too, that you take this off the shelf and you're depriving generations of patients and their families the opportunity to heal through
I
really
know.
accessing that sense of inner objectivity. That's the way I like to look at it,
Right.
where you
Yeah.
see yourself as yourself in a way you
Yes.
normally can't do when you're just
Right.
walking around enduring the trials and tribulations of a
Right.
life that's been basically grounded and rooted in, to your point, shame
Right.
and the lack of
Exactly.
personal
But this
acceptance.
can give you an experience of being globally, universally loved. And you have an experience of it while you're inside the medicine.
Right.
And now that's called everything that has to do with shame into question. So
Yes.
now I can start going, but I felt this and I saw this and I realized I was connected to all things and that I've always been so loved and nothing ever changes that. So I wasn't a bad kid. I wasn't. So you start to work with, well, what would you need in order to, you think, see yourself more accurately, like blah, blah. This can combat shame relatively quickly compared to therapy.
Yeah, I love it. I love it because it gives perspective. And with perspective comes context too. When you got tunnel vision, you're like a mouse going around
Mm-hmm.
and round and round. And then when you get your consciousness expanded like that, it literally opens up not only, to your great point, not only your mind, but your body. And
Yeah.
then the unity between the two. And then not only your mind and your body with you, but your mind and your body with minds and
Yeah.
bodies of of everything.
Exactly.
So whether you're at Burning
Exactly.
Man, you're at Burning Man having a good time, or whether you're in your physician's office or within these clinical settings where these drugs are
Sure.
administered, you're having talk sessions and you're tripping, but you're tripping with intention, to your point,
Oh,
and
with intention and
integration,
yeah, and
and
safety
it's
and
all coming out. And I find them incredibly valuable and have epic potential for
epic
for
potential.
getting
Yeah, there's a
over our
couple